Healthcare workers use professional face masks, which fit tightly around the face, to protect them against infection. Disposable masks are unlikely to provide such protection, and they will not block tiny viral particles. However, a cloth mask can help prevent the spread of droplets. The Centers for Disease Control and Prevention (CDC) recommend that all people wear cloth face masks in public places where it is difficult to maintain a 6-foot distance from others. This will help slow the spread of the virus from asymptomatic people and those who do not know that they have contracted the virus. When wearing a mask, it is essential to continue with other precautions, such as not touching the face and practicing physical distancing. Surgical masks and N95 respirators provide greater protection, but these are reserved for healthcare workers only. Antibiotics only kill bacteria, they do not kill viruses. There are no circumstances in which gargling bleach might benefit your health. Bleach is corrosive and can cause serious damage. As SARS-CoV-2 is different than other viruses, no existing vaccines protect against infection. Some research suggests that garlic might slow the growth of some species of bacteria. However, COVID-19 is caused by a virus, and there is no evidence that garlic can protect people against COVID-19. Although SARS-CoV-2 does appear to be more serious than influenza, it is not the deadliest virus that people have faced. Others, such as Ebola, have higher mortality rates. Some viruses, such as cold and flu viruses, do spread more easily in the colder months, but that does not mean that they stop entirely when conditions become milder. As it stands, scientists do not know how temperature changes will influence the behavior of SARS-CoV-2. Thermal scanners can detect whether someone has a fever. However, other conditions, such as seasonal flu, can also produce fever. In addition, symptoms of COVID-19 can appear 2 to 10 days after infection, which means that someone infected with the virus could have a normal temperature for a few days before a fever begins. There is no evidence that a saline nose rinse protects against respiratory infections. Some research suggests that this technique might reduce the symptoms of acute upper respiratory tract infections, but scientists have not found that it can reduce the risk of infection. As the world becomes more connected, some regions are rolling out 5th-generation (5G) mobile technology. A raft of conspiracy theories appears wherever this technology sets foot. One of the most recent theories to emerge is that 5G is responsible for the swift spread of SARS-CoV-2 across the globe. Some individuals claim that 5G can help viruses communicate and often reference a paper published in 2011. In this study, the authors conclude that bacteria can communicate via electromagnetic signals. However, experts dispute this theory, and SARS-CoV-2 is a virus, not a bacterium. Wuhan was one of the first cities to trial 5G in China, which helps explain the origin of some of these theories. However, Beijing, Shanghai, and Guangzhou also rolled out 5G at a similar time. It is also worth noting that COVID-19 has significantly impacted countries with very little 5G coverage, such as Iran.